What's the best home treatment for vertigo? If you wake up and get out of bed and notice that all of a sudden the room's spinning around you, it's quite understandably worrisome. I've actually had patients who told me they thought they were having a stroke, and if you don't know what's going on, you can get really worried about this type of vertigo. But in a lot of cases, it's something completely benign. In fact, it's called benign paroxysmal positional vertigo. Now, that's a big mouthful. Most people just refer to it as BPPV. And BPPV is a positional type of vertigo that has to do with the way that your head is oriented with respect to gravity. BPPV is caused by a dysfunction with the semicircular canals in your inner ears. And those semicircular canals have crystals inside of them that tell you where you are in space. But if one of those crystals starts going somewhere it shouldn't, it can give you feelings like the room's spinning all around you. And the two most common things that cause symptoms of BPPV are rolling over in bed, and it's usually just turning on one side, or at least one side is worse than the other, or sitting up from bed. Those are the two most common times when people get that positional vertigo where it feels like the room's spinning around them. Now, another thing that happens with this type of positional vertigo is it's really bad. It can even make you nauseous and vomit at some times, but it goes away pretty quickly. That if you just sit still for about 30 seconds to a minute, usually it resolves itself. But then it goes back the next time you go into that side-lying position or the next time you sit up from bed too quickly. Quick head turns are other things that can activate this BPPV. But the good news is that there's a really quick treatment that you can do for it that oftentimes resolves it within 1 to 2 treatments when you do it at the clinic. But if you're at home and you're dizzy, you might not have someone to drive you, or you just might want relief right now without having to wait to call someone. And there's a home version of this treatment called the Epley maneuver that you can do on your own. Sometimes it's not quite as effective as if you go to have it done to you by a skilled clinician who knows what they're doing, but it's a quick treatment. You can do it at home and at least you get some relief. So here's how you do the self-Epley maneuver. Now, you first want to determine which ear is the problem ear. So if you roll over onto your left side and you start having dizziness or vertigo, then that left ear is probably the problem ear. If you roll over onto your right side and you start having dizziness or vertigo, that ear is probably the problem ear. And you want to put the problem ear down during this test. So the way that you do it, I'm going to show you from a back view. I think that's where you'll have the best viewing angle. You want to start out sitting with your feet up on a bed and a pillow behind you such that when you lay down, it'll be at about your shoulder level so your head hangs backwards. Now for this demonstration, this is the ear we're going to be treating. And additionally, you want to be about 2 feet or so away from this side of the bed, because eventually you're going to end up rolling over onto this side and getting up off this side. So if this is the ear we're treating, the problem ear, you want to cross your arms across your chest, turn your head about 45 degrees towards the problem ear so that this ear is going to be down when you lay down. Then you want to lay down kind of fast with your shoulders over the pillow. So you'll go down, and here you will probably get rather dizzy. You'll start feeling those vertigo symptoms. You may feel a little bit nauseous, but just hang in there. After 30 seconds or a minute or so, it should start to subside. But just lay there until the symptoms subside completely. And then once they've subsided completely, turn your head towards the opposite side, about 45 degrees in this direction. And again, you may or may not get dizzy in this position, but hang out there until all your dizziness and vertigo symptoms pass by. Next, you're going to roll over onto this shoulder. And this is why you need the space at the bed so you don't roll off. And you want your viewing angle to be kind of down that way. So you're still looking diagonally down. And again, stay in that position until the dizziness and vertigo subsides. And then finally, you're going to use your arms and push back up to a sitting position, keeping your head down. And you may also get a little dizzy when you first sit back up. You do want to keep repeating this until all the dizziness has gone away. So if you notice you sit back up and you're still a little bit dizzy, you're going to want to go through the sequence again. And sometimes you feel better the first time. Oftentimes it does take 2, 3, 4, even 5 times through to completely relieve the dizziness. So to show you again, you start out with your feet up on the bed, about 2 feet or so between the side of the bed. Then you're going to turn your head 45 degrees towards the ear you're going to be treating. So this side is going to be down. You lay down fast. And again, wait for the dizziness and vertigo symptoms to subside. Once it's all passed, turn your head to the opposite side, again, 45-degree angle, and stay there until all the dizziness and vertigo has subsided. Next, you roll over onto your side, so you're looking downwards, and stay there till all the dizziness and vertigo has passed. And then finally, you sit back up, keeping your head down. And you'd repeat that as many times as you need to. Now, it is probably a good idea to have someone else around when you do this, both for peace of mind as well as for safety's sake, to make sure you don't roll off the edge of the bed, because you're already going to be a little bit dizzy. And if you just don't feel comfortable doing this, or you're not sure what you're doing and you don't want to make things worse, it's probably a good idea to reach out to a professional, either a doctor or a physical therapist or someone else who's trained in doing this procedure, to get professional help for it. And if you happen to be in the St. Louis area, we'd be happy to help you out here at More for Life. And no matter where you're watching this from, if you found this video helpful, give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.